using it in Chicago and Orlando, Florida so far, but it's new. It's been about a year that we've actually had the real training for that kind of technology. And it's faster and better and more phenomenal than anything that I have ever worked with. It's amazing. You can do map the back. It gives you readings. It tells you where to treat. Sometimes it surprises you where the nervous system is asking you to treat. And why it's different than anything that we've ever had. Cold laser, remember I could change the frequency and the timing, that's about it. This is like it's a dynamic biofeedback. It actually reads the nervous system, what's going on in that person. It puts in a healthy nerve impulse, and if your nervous system is not paying attention to it, it changes the pulse, the amplitude, the wavelength, things we've never been able to change before. And instead of me trying to guess what's going on and change those things, even if I had the power to do that, what am I going to know what I should do? It's reading the body and having a biodynamic conversation with the nervous system. And I explain it to the patients. It's like your hard drive on your computer. You can have all the best software in the world, but if the hard drive's down, nothing's going to work well. So by lining up that nervous system, getting that nerve impulse to be at a healthy nerve impulse, it's phenomenal how quick the body can make change. People come in a level 10 pain, they leave in a 0, and it's a 5-minute treatment, if that. It sounds too good to be true. I thought that until I started working with it for the past year, and I have people all over the country now flying to see me. And it's word of mouth. Don't advertise it. It's going to, as we're getting the studies done, there's some women's pelvic floor studies and pelvic pain studies that are being done out of Las Vegas, and a large study being done with the military has a post-traumatic stress disorder and brain damage center in Long Island, and we flew out there. They'd heard about the technology and they're using it on some of their vets, and so the military's aware of it now, and so you will be hearing about it, but you get to hear about it tonight before it becomes big, which is kind of fun. Yes?
You're using this specifically to address physical pain. Is there anything going on yet, or are you preparing to set up something with these PTSD vets and the emotional?
That's what they're doing. It's for post-traumatic stress disorder. That's what they're seeing it work on. Yes,
because
and
they've done is more and more that pain is pain.
Absolutely, absolutely, absolutely. And so that PTSD is being studied at that center in Long Island. And it has already been studied in Russia, and dementia, Alzheimer's, PTSD, all the emotional things that go along with it. That's a big portion that we see with this.
So are you going down the path with clinical depression then?
We see that get better, and you know why? I think a big portion of it, people, no matter what we're treating with it, when you start lining that up, they all come back and say, I'm sleeping better. I slept through the night. It was fantastic. It was great. They're sleeping better, and lots of things clear up when that happens. Yeah. A few sleep disorder researchers in the room going. So
it's the when people get depressed, sleep is the first sign that something's going wrong, and when they recover, it's the last thing that goes back to normal.
Interesting. Yeah. So those all, anxiety, depression, all that, and you can get to it immediately with that treatment. It calms down the nervous system. It swings them from sympathetic if they're there in a parasympathetic, or if they're depressed, parasympathetic, sympathetic. It's working with that autonomic nervous system. And you see an emotional change. You see their eyes light up. They get better. Even if they're not coming in for pain, they're coming in. I have grand mal seizure patients. I have ones that have silent migraines that pass out constantly, and they're not doing it anymore because we're just lining up the nervous system, is the way I explained it to them. It's beyond that. And we know that it's not just the nervous system. We know it's the matrix, which I'll be talking about in a minute, all the things that are in between the cellular communication, where the proteoglycans and all this is. There's a whole nother communication besides circulatory and nervous system and all these, and hormonal systems. The matrix is where we think a lot of this kind of technology works, and the Russians are studying that. They haven't let it be translated yet, but they are actually studying matrix communication with this. So it's not just the nervous system this is working on. Okay, I think 30 minutes later, we go to the break. You keep going through all this. You guys are in Arizona. I don't think I need to go through this slide of all the things. Just keep going, keep going. All the things that we're trained in. But, you know, realizing that you've got to address all of these things at some point to get a patient better. And not just specialize in one. You have to address the emotional, psycho-emotional as well. You can keep going. What's aesthetic medicine? Aesthetic is either weight loss or natural, and you know, natural collagen building things. What's the alternative to Botox? It's actually called no-tox and no-toxin, and that will be another version of this scanner because it builds collagen, it tightens, it firms, it does all. And we're not launching that here because we want scanner to get its medical foot of real research and what it really, really does. But it's phenomenal what you see happen from an aesthetic standpoint. Aesthetics is beauty medicine, right? These are some of the things. I am a diplomate in the American Academy of Pain Management. There's 8,000 doctors in that. I have lectured on some of the Italian homeopathics for that group. Soon I'll be lecturing on scanar. They're aware of cold laser and frequency, but they're mostly traditional pain management docs, but they're willing to hear and step outside of the box of what they're doing. So it's a great group. You know, they believe in the counseling part and the social part, and so it's a good group. I'm a board member of a lot of different organizations, regenerative injections, prolotherapy, platelet therapy, where we're drawing your own blood, you spin it down, you get platelets, injected into the joints, it's your own growth factors. So if it's leading edge or if it's something new, I'm pretty much on it. I want to know about it. I'm going to use it for a while and decide whether I stay on it. So I've got a lot of tools and a lot of things that I have been trained in. However, tonight is my passion. It is the bioenergetic body. Okay. Let's go on past this one. This group gets it. We understand that the mind-body connection and what meditation does. A lot of you are researching that. But as far as bioenergetic medicine, it's not new. It's thousands of years old. It's been used in Egypt and China. They used electrical eels. It was used in the U.S. 1884, 10,000 docs in the United States were using it, and that was pretty much everybody. And then the Flexner report came along, if you're aware of that, where we turned into a pharmaceutical model and a surgical model. Our mindset changed and all these other things got pushed out. Homeopathy and everything got pushed out of the way. But 20th century now, what is an EKG measuring? What is an should be ECG, but what does an EKG do when you go to the hospital? You're worried about your heart. What is it a measurement of?
Electrical activity in the heart.
But is it measuring the heart activity, or is it the field that's created? It's creating that electromagnetic field that heart created. What's an ECG? You know, what are the brain maps that we do? It's the electromagnetic body. So we're using it to diagnose. Why is it so far-fetched for us to think that it would also could be used for treatment? Okay. This is a great book, just a good little basic book that I tell physicians when I'm lecturing, Energy Medicine, The Scientific Basis by James Oshman. It's a good place to start. There's some basic studies in there, some fairly well-done studies, learning just some of the basics of bioenergetic medicine and some of the science that has been done on it. It's fascinating. It's a quick, easy read. It's not going to be, you know, a thick textbook that you're going, oh my gosh, how can I get through this? If you're interested at all in the subject, it'll be a fascinating, fun read for you. He's done some other books off of it, but that's the basic one. And there's a lot of research that's happened since then every day.